Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will begin on an organization that has grown to be Wisconsin's largest and most trusted reproductive health care provider, Planned Parenthood of Wisconsin. For 80 years, they've been providing the health care, education, and advocacy people need to make informed, responsible decisions about their sexual and reproductive health. Nicole Safar is the Executive Director of Planned Parenthood Advocates of Wisconsin, and Katie Mullen, she is a Planned Parenthood patient. Good morning, ladies.
Hi.
Thank you both for being here. And Nicole, Planned Parenthood of Wisconsin's been around since 1935. So if you would, tell us about all of the outstanding things that you offer to individuals on a daily basis.
Great. Thank you so much for having us on this morning. Planned Parenthood of Wisconsin started right here in Milwaukee, and as you said, we've been providing reproductive health care services to the city and the state since 1935. We also, beyond the preventative reproductive health care that we provide, we have an education department that provides sexual health education for professionals, for teachers, for students, for parents, and then we do advocacy as well out of the Advocates organization. So that means we are working at the state, local, and federal level to support policies that increase access to reproductive health care, that help the public health outcomes overall in the state, that are focusing on ways to reduce infant mortality rates and reduce unintended pregnancy rates, and really make it so every family can plan for and space their pregnancies.
Yeah, and we'll talk a little bit more about that advocacy part of it all in just a little while. But Katie, as I mentioned, you are a patient of Planned Parenthood. If you would talk about the services they offer and how they've been beneficial to you.
Sure. I think that I couldn't give you the full list of services as
right.
thoroughly as Nicole could, but from my personal experiences, I've seen Planned Parenthood as a patient in need of reproductive health care that I couldn't get anywhere else. Particularly a couple of years ago when I decided to take a huge risk in my life and start a business and went without health insurance because I couldn't afford it at the time. And Planned Parenthood was a place that I knew after being turned away from my my regular health care provider because of lack of insurance. I knew that Planned Parenthood would see me and would take care of me, and they did that.
Yeah, and there are so many women out there like Katie who, aren't necessarily falling under the, low income, but she started a new business. Anybody that knows about entrepreneurship knows that you kind of got to get off the ground, and then if she decides to hire other people to work, then that's something else she'd have to come out of pocket for to cover them. So there's a lot of stories that really all really go to that bottom line that Planned Parenthood is needed, and this is something that you've tried to get people on both sides of the aisle to understand, right?
Yeah, I mean, 1 in 5 women in the state of Wisconsin has been a patient of Planned Parenthood sometime in her life. Women understand, I think, that getting access to basic reproductive health care is challenging, and it can be challenging for many different income levels. It's not as easy as going to the drugstore as some of our politicians might try to tell you. So Planned Parenthood is really proud to be there and to be a place where women know they can go for a non-judgmental, affordable health care no matter what their insurance status is. And it is we provide the full range of reproductive preventative health care, from birth control information and services, STD testing and treatment, well women exams, cervical and breast cancer screenings, really the sort of basic health care that all women of reproductive age need annually and oftentimes struggle to get.
Yeah, and if people pay attention, then you also strategically are placed in areas where people can easily have access to the services you provide, right?
That's our hope, yes. Yeah. We try to meet our community's needs and to be in places where people need access. That's why I think over 60% of our clinics are in underserved areas, whether they be underserved rural communities or underserved city settings.
Yeah, and despite all of the outstanding services that you guys provide to women from so many different walks of life, as we pointed out, Planned Parenthood has faced a bit of controversy over the reproductive procedures that's offered at some of the clinics, and we've seen the debates over women's rights played out all over the country and right here in our state for that matter. So as an advocate, if I may ask your opinion when it comes to your thoughts pertaining to women's health issues and that really crossing the lines into politics. Yeah.
Yeah, it's been really intense, especially over the last 10 years, I would say, of how political women's health has gotten. And I think you were referring to the fact that Planned Parenthood of Wisconsin also provides abortion services at 2 of our health centers in Wisconsin. And abortion is a really complicated issue for a lot of people. It's an issue that we come to with our own values and our own sort of sense of life experience. And it is something that people feel very passionately about on both ends of the spectrum. It's something that at Planned Parenthood we understand can be emotional and can be complicated. And what we really strive for is being there for women and their families to provide all the information, access to any healthcare service that she might decide is best for her, and really that support that she needs to make her own decision. And that seems to be the crux of the issue. It is incredibly important for us to be there as long as abortion remains a legal healthcare service in this country. We believe it is our duty to make sure as a healthcare provider women have all the information and then have access to that service if they decide it is best for them.
Right, so the most important aspect is that Planned Parenthood provides affordable, quality, and confidential health care to more than 61,000 people each year in 21 health centers throughout Wisconsin.
Correct.
I think that says a lot, and an important issue that has made headlines is the reduction of funding for Planned Parenthood from the state to the federal level. So if you would give us the basis of these cuts and the consequences that would come with those if in fact it is followed through. So
the vast majority of patients at Planned Parenthood of Wisconsin are in the Wisconsin Medicaid program. So they're in Badger Care, essentially. They're enrolled in Badger Care. And Planned Parenthood is the healthcare provider that they go to for the expert reproductive health care. Speaker Paul Ryan has a bill that was passed in the House of Representatives, and I'm sure that your viewers have heard it as a repeal of Obamacare or repeal of the Affordable Care Act. Well, as a piece of that bill also was a provision that would prevent Planned Parenthood from being a Medicaid provider. And essentially what that means is that women who have Medicaid as their insurance coverage could no longer go to Planned Parenthood. Well, the thing that nobody talks about in Speaker Ryan's party is that Planned Parenthood isn't just an option for those women, it's often the only option. So it's not like you can just go to the next provider. Women who are on the Medicaid program, there is not a full sort of directory of places where they can go because you don't make money off of Medicaid. Medicaid reimbursement rates are very low, and Planned Parenthood is a nonprofit charity care provider. It's our mission to make sure people get health care, and not all health systems have a mission like we do.
Wow, and it gets so complicated when politics gets mixed into it, as I said before. And I've heard Congressman Ryan tout federal community health centers on several occasions, which I'm sure it's not as simple as him stating that they don't have to go there, they can just go there. But with the number of people that you serve on a daily basis, it probably would take forever for people to even get an appointment to see a doctor under those circumstances.
It always makes me smile when we talk about Speaker Ryan, and he said, oh, the federally qualified health centers, they're doing such a good job and they can just take care of all of these patients, tens of thousands of patients. Speaker Ryan isn't the one on the front lines that's actually working with the federally qualified health centers, but Planned Parenthood is. We partner very closely with many of the federally qualified health centers. We refer patients back and forth. We understand what the healthcare landscape looks like on the ground, and we know that there are not enough providers today as it is to serve all of the patients in need. It's not about shifting patients from one place to another. Really, the discussions we should be having is how are we investing in these communities right now? How are we expanding access? And Speaker Ryan continues to put forth proposals that are talking about taking away access, and we still don't have enough today for our community.
Wow, it's very interesting. And Katie, not going to forget about you over there. You actually had an opportunity to travel to Washington, D.C., go to Capitol Hill, and talk to your representative about Planned Parenthood, the services they offer, and how they have helped you along the way. So tell us about that experience and what you feel came out of that.
Well, the first thing I'll say is that it was an incredibly emotional experience, more than I realized it would be, but it was for a greater cause, and I'll tell you kind of what I mean by that. So the experience was hundreds of women from across the country meeting on Capitol Hill, patients of Planned Parenthood, for a day called Patient Lobby Day, and we all did what I did that day, which was meet with our representatives and tell them our very personal patient stories and tell them why, from our perspective, Planned Parenthood is so essential to our communities. And it was interesting because some of us had people who were friendly towards Planned Parenthood, and some of us, like me, had were talking to lawmakers who were vehemently opposed to what Planned Parenthood does. And so that's where when you're putting your heart out there, you're putting your heart and soul on the line. And I'm a very private person normally, and I'm telling this deep story about. So the one I told you earlier was more about just I went there for reproductive healthcare services and I didn't have insurance. But the deeper story is that I'm a businesswoman from their district, a businesswoman who didn't have insurance when she started her company, right, and relied on them for that service. But beyond the reproductive healthcare services they provided, they really saved my life because they recognized that at that time, and I get a little emotional when I talk about it, but they recognized that at that time I needed care beyond what they could provide. Mental illness runs in my family, and I thought I was out of the woods for getting mental illness because I was in my 30s, and often it manifests in your teens and 20s, right? And so I thought, okay, you know, maybe it's gonna skip me, but nope, it did not skip me. And I was going through a really dark time, a time where I didn't know if I wanted to live. And so when I was seeing Planned Parenthood at this time, the only healthcare provider that would see me for any type of care, they recognized and asked me questions about my mental health care. And even though it was something they couldn't do for me, they made sure that I got insurance in order to be able to be seen to take care of that in my life. So I credit them, and I got on Badger Care. I had no idea Badger Care was an option for me at that time, and they walked me through the process of applying and getting it start to finish, and it made all the difference in my life. It's why I have a thriving business today, why I'm healthy today, why I'm still on the planet.
Yes, and here to tell your story, which I
story.
think that it means so much that you are comfortable sharing that story. You'll be surprised how many people you help and encourage who are watching you. So thank you for that. And I do want to mention that I guess Sensenbrenner, as your representative, he was not there, but did show up when you guys were leaving. So they had staff members there to hear your story. And then Paul Ryan, he was not around either to hear it, which I think is disappointing, especially if you have alternatives, things, I was going to say alternative facts, we all know, but alternative ideas to it. At least open yourself up to hear what you may not fully understand. So whereas you have these people, including the President of the United States, who have come up with ways to defund what it is you do have allies in Washington, D.C., and one of those would be Congresswoman Gwen Moore. I like to call her Superwoman, and she created a very interesting video that was directed completely to House Speaker Paul Ryan. Let's take a look.
Speaker Paul Ryan and congressional Republicans are determined to defund Planned Parenthood as part of their strategy to repeal the Affordable Care Act. In response to their threats, Planned Parenthood volunteers visited Speaker Ryan's office to deliver nearly 90,000 petitions in opposition to gutting this vital healthcare provider. But when they arrived, they were met by armed security and a locked door. Fortunately, there are allies in Congress who are committed to protecting women's health and the organizations that provide reproductive services. We will always be here to listen to Planned Parenthood and to support their mission. When it comes to women's health and the welfare of my constituents, my door will always be open. So, Mr. Speaker, we're going to hold on to these petitions for you. The American people have spoken, and they deserve to be heard. Will you listen, or will you shut your door again? In the meantime, if you want these petitions, you know where to find them. Or we would be happy to deliver them to you personally.
I love her. So it's just kind of like, was there ever a response?
You know, I don't know if he reached out directly to her. My guess would be no, but Congresswoman Moore has done almost more than anybody to hold Paul Ryan accountable on Planned Parenthood. And if I were Paul Ryan walking down the halls and I saw her, I would turn the other way. So she has certainly been a loud and strong champion for women in our state and for Planned Parenthood, and we are so grateful for her work every day.
Yeah, she totally gets it, and she has her own story to tell when it comes to being a young mother and needing services like what Planned Parenthood has to offer to women each and every day. So I thank you both so much for coming by and sharing the information, and I'd love for you to keep us up to date with everything that's taken place. And is there anything else that you wanted to share before we wrap up?
I just want to say thank you for thanking Katie for telling her story, because I think we ask people want to know how they can help and how they can be supportive, and really telling our own individual personal stories and sharing them with our family and friends, sharing them with Planned Parenthood and maybe the broader public if you feel comfortable, makes such an impact. And if we're going to change policies in our state and in our country, we're going to have to use our voices, and it really, you can make a difference.
Yeah, I think that was well put. Thank you both so much for being here. I appreciate all of the hard work that you're doing, and you're welcome to come back anytime.
Thank you.
Thank you, Nicole Safar. She is the Executive Director of Planned Parenthood Advocates of Wisconsin. And Katie Mullen, she's a Planned Parenthood patient. For more information on Planned Parenthood of Wisconsin, you can visit their website at ppwi.org. When we return to our Issues Milwaukee, we'll switch our attention to men's health and discuss an upcoming event that is specifically set up for fellas. We'll find out more about the 4th annual Fellas 5K Men's Walk right after this.